My name is Julissa Chavez, and I did my project on total knee replacement rehab. Here is a short film of how the surgery works.
Your knee joint is made up of the lower end of the femur, which hinges on the upper end of the tibia, and the patella, or kneecap, which slides along the groove formed by the femoral condyles. Total knee replacement surgery is a procedure in which a painful or poorly functioning knee is replaced with artificial components. If your physician has recommended a total knee replacement, it is probably because your knee is severely damaged by arthritis or injury. Your surgeon will begin by making an incision along the front edge of your knee. After separating the muscles and ligaments around your knee, your surgeon will incise the knee capsule to gain access to the inside of the joint. Using specialized tools, your surgeon will remove the damaged bone and cartilage on the ends of the femur and the tibia, and in most cases, remove the underside of the patella. Your surgeon will then prepare the remaining bone to receive your new prosthetic knee. This generally consists of a femoral, a tibial, and a patellar component. Once the ends of the bones are prepared, your surgeon will cement the new prostheses into position. Before your incision is closed, an X-ray will be taken to ensure that the new components of your knee are positioned correctly. Your surgeon will close the incision with stitches or staples and temporarily leave a drain in place to remove excess fluid.
When waking up after your surgery, your knee may be in a device called continuous passive motion or CPM machine. This machine helps to gently and slowly bend and straighten your knee while you're lying in bed. There are settings on this machine to adjust the amount of motion that occurs at your knee joint. Your doctor and physical therapist can work with you to make sure the CPM machine is set properly. After 2 to 3 days in the hospital, you should have improved functional mobility and may be discharged to your home. If you still required skilled nursing or more intense rehab, you may be moved to a subacute rehab facility. There you will be able to focus more on gaining knee range of motion and strength to ultimately improve your function. Subacute rehab lasts about 1 to 2 weeks, and a typical day involves 2 sessions of physical therapy. Your PT will continue to work on improving your knee strength and range of motion. By the 3rd week after your TKR surgery, you should be working in an outpatient physical therapy facility. More aggressive range of motion exercises can be started, and your knee motion should improve gradually to about 100 to 105 degrees by the end of week 6. Many people benefit from riding a stationary bicycle after surgery. Your physical therapist will help determine the proper seat height for you. You gradually work on the pedals forward and backward, and as your range of motion improves, you should be able to fully pedal on the bike. There should be a continued focus on strengthening exercise after your TKR surgery, and your PT will teach you exercises to improve the strength of your quadriceps, hamstrings, and hip muscles. During the final 2 weeks of your post-operative TKR rehab, you should be working with your physical therapist to maximize your functional mobility. Exercises should continue to focus on gaining strength in the muscles around your knee and leg. More advanced balance exercises can be progressed, and the use of BAPS board may be included in your therapy to maximize your balance. During this time, you should be able to fully progress to walking normally with no assistive device, and your pain should be under control. As you approach the end of your TKR rehab, you should discuss with your PT options for continuing your exercise program independently.